Well, we've heard from the voters, the political leaders, and the insurance industry since the passage of the big healthcare overhaul last spring. But today we are hearing for the first time from a group called the National Doctors Tea Party. They seem to be most angry with the American Medical Association for supporting that overhaul. Joining me now is Dr. Adam Dorin, president of the Tea Party Doctors and a board-certified anesthesiologist. Dr. Dorin, thank you so much for being here. You are fighting mad about this healthcare law, and you're really upset with the American Medical Association, the AMA, which you say abandoned the doctors and their interests. How so?
Well, thank you, Megan, for having me. You're absolutely correct. The American Medical Association represents, at best, about 17% of practicing physicians. There are about 750,000 actively practicing physicians in the United States. Some suggest that the AMA's membership now is down to about 10%. Despite that, and despite the fact they have an exclusive coding deal with the U.S. government to have the copyrights for the codes that all doctors must use to bill for insurance, government or not, they betrayed their own constituents. They went forward in a rather self-serving manner to support a legislation that doesn't help quality. It's not going to help patients. It's not going to help physicians. And so we're not happy about that.
There's no question that the AMA's support of the health care law was important to the Obama administration. And the AMA sort of went back and forth for a while, but they wound up supporting it. And that meant a lot. That was used by the Democrats who favored the law. Nonetheless, why complain about it now? I mean, it's the law. And the AMA, you know, its support is done. I mean, it's what use is it to now complain about them or it?
Well, it's a good point. Now, docs have been complaining about this for a while. We were not happy with this, and there's Independent Business Daily poll going back to September of '09, multiple other polls before and after the legislation was passed this past spring demonstrated that most Americans and most doctors were not in favor of this. Nevertheless, the AMA still had their little white coat representation in the White House, which was very disingenuous. We believe that we can work toward flipping the House, defunding this legislation, before, if perhaps a legislative victory occurs that declares it unconstitutional, and or we can get it eventually repealed and replaced. It's not a good legislation. It elevates non-physician providers through legislative fiat to perform the role that physicians traditionally perform. Most Americans don't want that. That's not going to be good for health care. There are better ways to protect Americans than this legislation.
You're an anesthesiologist. How, in your view, will this law creep into your practice, affect what you do?
Well, in general, one of the things it does is it downgrades physicians, non-physician providers within my specialty, for instance, CRNAs, nurse anesthetists, who do a wonderful job, but we believe need to be under medical supervision. This law encourages the elevation of nurse practitioners, techs, and PAs to eventually perform the role that physicians perform. Furthermore, by sort of squeezing the medical profession, if you will, and adding another 30 million people to the government health insurance rolls, in essence, what you're going to need is actually docs from out of the country who may not even be American trained. We don't think that's the way to go.
Right.
We feel that you can...
Understandably, the American doctors don't want to see that for many reasons.
I created PhysiciansAgainstObamacare.org. It's just a volunteer website to bring attention to the fact that we need to reform this misguided and flawed health care reform legislation. Now, the AAPS is a wonderful organization, great organization, which is a very important subject. This health care reform legislation, the AMA, which represents almost no physicians, it needs to change. We need to redo it.
All right, Dr. Dorin, I appreciate you coming on and sharing your views with us. All the best.
Thank you, Megan. Thank you.